Welcome, everyone, to the Friends of NPACE Podcast. I'm Terry Schmidt, the Executive Director of NPACE, and I'm also a practicing family nurse practitioner, as our regular listeners know. And this is an exciting podcast. I'm very excited to introduce our speaker and guest today for the show. And Shannon, just so you know, the audience knows that I mess up all the time. We keep this very casual, so they're very forgiving. But I want to introduce Dr. Shannon Idzik. She's a professor and associate dean for the DNP program at the University of Maryland School of Nursing. Prior to her current role as the associate dean of the DNP program, she served as the program director for the Adult Gerontology Primary Care NP program and the director of the DNP program. She currently maintains a faculty practice as a nurse practitioner in the University of Maryland Upper Chesapeake Medical Center in the Comprehensive Care Center, where you care for uninsured and underinsured and medically complex patients, which we could have a whole discussion about that. I love that. Dr. Idzik is the president of the National Organization of Nurse Practitioner Faculties, or NONP, and previously served as treasurer and the NONP representative to the current revision of the National Task Force Criteria for Education of NP Programs. The 19-member task force sets the national standards on NP education in the U.S. She's active in the professional community, serving as Collegiate Commission on Nursing Education, CCNE, site visitor, visiting and assessing schools for accreditation. She is a president of the Nurse Practitioner Association of Maryland, or NPAM, and subsequently led recommendation number 1 to remove scope of practice barriers for advanced practice nurses and the Maryland Action Coalition, yay, full practice authority, part of the future of nursing for more than 5 years. She has served on numerous state work groups and has spent the past 3 years serving as one of 11 non-federal members and the only nurse practitioner on the Federal Advisory Commission to make recommendations to the United States Congress on diabetes care, which is a topic near and dear to my heart. As a fellow of the Wharton Executive Leadership Program and Leadership for Academic Nursing Program, Dr. Idzik received in-depth leadership training, which she's used to enhance her professional career and mentor others. So welcome, Dr. Idzik. How are you?
I'm great. Thank you so much for having me.
We're going to talk today about the DNP degree, because this is a question I get a lot from students, from practicing nurse practitioners, is why should I care? Why should I go back to school? Why should I get a DNP degree? Do you get those questions?
Of course, I do. All the time. Yes.
Good. Well, we're going to dig in. But something I'm trying to do this year and this season in our podcast is to start with the nurses and just ask, who are you and how did you find your way into nursing? What's that story like?
It's interesting. When people ask me how I found my way into nursing itself, I have a hard time because I think, I was a first generation college student. My parents were very much about having a profession, like something you could get out and say you were, right? They didn't want me to have any, broad ethereal degree. They were like, you can be a teacher, a doctor, a nurse, a fireman. They wanted me to have a career. They didn't want to pay for 4 years of college and me end up not being able to get a job. And so I was always interested in science. And, my mom, again, I was a first generation college student, but I felt like our family always had an interest in health and well-being. So I think that's how I ended up deciding to go to nursing school, but I really don't remember. And, I will say whatever, guided me on my path, it was a wonderful decision. Nursing's a great career and a great profession. And, how I ended up being a nurse practitioner was really interesting. I found myself increasingly frustrated with decisions people were making at the bedside, not just patients, but also providers, right? So I remember thinking, oh my gosh, like someone needs to talk to patients about end of life. I was a critical care nurse at the time, and I would often say, oh, please, to go home to my family and say, please don't do this to me. And I just really started thinking, gosh, I need to be able to have those conversations with people before they end up in the ICU.
Mhm.
And so I thought a lot about that. And then I also, I thought, geez, one day they're wet, one day they're dry. I need to figure out why these people are making these decisions and make them myself. Right. Of course, as in part, I want to have the knowledge to make these decisions and make the right decisions. I ended up going into primary care really because I wanted to help people make good life decisions about their health care. And so I chose the primary care route versus the acute care route, even though I was a critical care nurse. I wanted to be in that place. And then in terms of education, I always loved having new students and really helping them, see that light bulb, whether they were new nurses that I was orienting to the unit or and then as a nurse practitioner, the same thing. I loved having that light bulb. I loved telling, and a lot of it, I think, goes back to telling people about what I'm passionate about, right? What I love to do.
I love every bit of that journey, and I can see so much overlap in so many of the nurse practitioners I talk to about how they found their way into this. I had been in pediatrics for years in critical care and in urgent care, and I took a school nursing job. And it was in that job I'd been thinking about graduate school, but I was doing all the primary care anyway and had all these kids who had no access to healthcare in a city public school. And I'm like, I could do this. I just got to go back to school, right? Oh,
Yeah,
interesting. Yeah, and
absolutely.
somehow
Yeah.
we always get roped into teaching and then it just progresses
Right. I
from
mean, and
there.
so
I
much
think,
of what we do as nurses is in part teaching, right? Teaching patients, teaching families, teaching. So yeah, it is it is a lot of a natural transition.
yep, I completely agree. Um, so to start us off, what is a DNP degree? What is it?
Right. What is it? So I think when I start to think about, I often will phrase it in the terms of difference, right? But I think really it's the highest level of nursing practice. That it's educating nurses, and that really is across the continuum of advanced nursing practice, whether it's in the roles area, of nurse practitioners, midwives, CNSs, nurse anesthetists, or in the specialties where informatics or public health, leadership, policy. It's that highest level of practice of nursing. And I will often again compare them to other degrees, much like the medical doctorate is the highest level of medical practice, or the PharmD is the highest level of pharmacy practice. It is the highest level of nursing practice. It does not have a focus on research, um, although there is obviously a component of research in nurse DNP programs and in any medical profession. You have to understand research and be able to apply it to practice. But it's really about that evidence-based practice, quality improvement, leadership, policy, having people understand that systems thinking, and translating that research that our PhD colleagues are doing into practice, improving patient care.
Yeah. No, I think that's a really good way to put it, that it is the highest level of nursing practice. I find that some of my DNP colleagues are even really dabbling in the realm of research, especially in partnerships, because they get it at this really high level of what's happening and where the gaps are because they're living it every day, right, in practice.
Yes, and I love that because people will say to me, so can I do research as a DNP prepared nurse? And I say, of course you can, right? Of course you can. The difference is your education is not focused on doing research, right? But I do hope that you will participate in it and maybe potentially lead it someday, right? When you think about any high level leadership position, you don't necessarily have to be an expert in everything you're leading, right? Um, you know,
Agreed.
we see people leading organizations all the time, and certainly the chief executive officer of every hospital isn't necessarily any of one of the healthcare providers that's there. Their leadership role is different. So I do hope that our DNP prepared nurses do get involved in leadership and involved in research and participate in research. But I think they help inform the questions often. Sometimes our PhD colleagues are a little bit more removed from day-to-day patient care, and they may not have the current questions. And sometimes as we're applying their research into practice, they have identified solutions to the problems we're having here. And we put them into practice and we say, but that doesn't really answer this question. What's the next question? I think the partnership is really critical with DNP prepared nurses and PhD prepared nurses. And, really working in teams is great.
I completely agree. It's going to take a village to get some of this move forward. And there's not enough nurses doing research anyway, or policy, in my opinion. So I love that. So how is it different than a master's degree or even a certificate NP degree?
How is that? When you think about, I think it's a much broader, it's a breadth. I'll often say it's a breadth and a depth of knowledge in those areas of evidence-based practice, quality improvement, leadership, policy, statistics, systems thinking, informatics. So, many of our master's programs have a little bit of that, but at a smaller level. There's just not enough credits to really cover it at the level that I think is needed to change healthcare. They might, have a couple of modules on leadership as opposed to a course on leadership. And I think it's really about leading healthcare and leading healthcare change. I think, in my mind, those are kind of some of the big things. There's still that content there in some of the master's programs, but not nearly at the depth and not nearly at the breadth that they have in a DNP program. One of the other areas, is the implementation, an implementation project, a DNP project, a scholarly work of some kind, much like a PhD student would have a dissertation. And so that is one of the requirements of the DNP program. I tend to think of that more as a practicum, an application type project. They're taking all that knowledge that they've learned and really applying it and doing it again in practice so that when they get out, we know that they have that skill and that competency.
Project, the infamous project. One of the reason, besides time and money, that I hear why people are like, I'm not going back to get a DNP. I'm not doing one of those projects.
Yeah. I think it can, it's interesting that you say that, because I do think at some places, and I think sometimes people make it into something more than it needs to be. I really do think it is, it is a scholarly work. It's a kind of, in my mind, this culmination of all of that knowledge that they've gathered. I don't necessarily think it has to be at the end, but I do think it's taking all of those pieces and applying it. And again, I think if we continue to think about it more as an application, a practicum type experience, then it seems so much less onerous, right? Like, what are the problems in practice? And what's the evidence say we should do to fix them?
Yeah, and I think it's that dive into the depth of evidence,
right,
and the ability to do that with discernment, which this is certainly an age where you need to be able to dive into the evidence with discernment and know it, right, with confidence.
Yes, for sure.
So why should, if we're talking to, and our audience is primarily practicing primary care clinicians, what do we say to them about that DNP degree, or why should they consider it at this point? They've got established careers, they've got patient load. Like, what is it about that DNP degree that they should go, maybe I should think about that?
It is tricky, and I think a lot of it just depends on long-term goals and gain. Obviously education is an expense, and it's an expense in terms of time but also in money. And so I think, for every nurse, it's an individual decision. Every nurse practitioner, it's an individual decision at this point. But I do think, in part for me, I think going back to school and getting the DNP gives them the credential that's aligned with the skill and the work that they do every day. And I think that's important. I also think, I often say to people, have you ever gone to work any day and thought, geez, like, the world would be a better place if I could just change this? And my hope right? That they would get those skills in their program, that they could really try to fix some of those things. And I mean, I don't know about other people, but that pretty much happens every day in my life. There's always something that I'm like, the world would be a better place if I could just fix this. Sometimes it's around the quantity of email that comes into my email box, but
yeah, or meetings,
right? Or meetings, the quantity of meetings and the length of meetings that I spend all day long. But I do think those are the skills that we're hoping to change for them. I think social determinants of health, again, a focus on systems change and policy change are huge things. And I do think those things are areas that they could really build on. The great thing about being a postmaster's DNP student too, is I think there really is an opportunity to kind of craft your education, sometimes in a little bit of a different way. The basic competencies are still there, but as you're looking at evidence, what are the things that are really impactful to you, important to you and your patient population? And whether that's you're an independent practice and you're really looking at how to decrease your no-show rate and increase your, revenue at the end of the day, or whether you're in an underserved clinic and you're trying to figure out what are the barriers to vaccine uptake? How do I change that and help my patient population? Those are things that you can really work on in the program, and you can craft that, as opposed to writing a paper. If you're an adult gero provider, you don't really need to be working on pediatrics. So I think those are the things that you can focus on while you're in school and help improve your day-to-day practice and your day-to-day work.
Yeah, I would agree with that. And that I don't have a DNP, I have a PhD because I'm old enough that DNPs were just little baby degrees and we didn't have many of them.
Right.
But that's exactly how I came to it. I was, in a diabetes practice, pediatric, type 1, and I had all of these girls who, with really high A1Cs, were misusing their insulin. Of course, to be thin, which is a whole nother topic, right? And it's now this big thing, but we just didn't talk about it back then. It was like sex. If you don't talk about it, then the kids won't do it. Right. And so I kept saying to my collaborative pediatric endo MD, I kept saying that this is an issue. This is an issue. Finally, I'm like, okay, I've enrolled in a PhD program because we're going to study what are the contributing factors to this behavior. And it changed my practice. It really changed the way I looked at things. And I never went into school intending to be where I am now, but I really think it gave me the tools.
Yes.
A doctorate degree did. And just the process of that opened doors, right, for me that I was forced to do in-depth. I was forced to write policies. I was forced to do poster presentation. And each one of those things, I met another person who had great impact on my practice or my career, or was just life-changing.
I also think sometimes it just gives us a seat at the table, the credentials.
Yes.
And I'm not sure that's like the reason, right? That's not the reason to go, but I do think having those credentials sometimes gives us a seat that we wouldn't necessarily otherwise get. And I think in part that is because people know the level of work that goes into it and the thinking that you've gone through to get to that place. I also think that opening of doors, one of the things as I talk to our postmaster's graduates, sometimes I always say, this is your last time to look behind the curtain. It's really difficult to go to the White House and hang out with them on any other day. They start to look in they start to do a deep dive into why you want to be hanging out in the White House. But if you're there as a student under, for the purposes of learning about the Office of Drug Control or the Office of Drug, Policy, you can go in a very different way. It's really difficult to get into those doors and into those places when you're not a student. And so if you have that interest and you're really interested in shifting your career in some way or broadening your career, I think going back to school for a doctorate is a great opportunity if you're a practicing NP.
I completely agree. And you can craft it to whatever you want. It is not just a list of rules and assignments. You can take it and really make it and breathe life into it. It's like if we all got to go back to school, and I always said I would go to Hogwarts, but you can make it. I'm going to be a witch.
That would be really fun.
I know. I need magic. for the meetings. So
Right.
some people are opposed to this degree. So I have friends who've done a DNP and they're like, well, that was useless. It was a bunch of discussion boards and reading. It's kind of the same arguments we heard when associate degree nurses go back for a BSN completion degree. And so how do you address in conversations those kind of concerns about a DNP degree?
So I think, well, to go back to my prior statement about you can make it what you want it to be. So I often think when people say to me that was a waste or what have you, I often think this similarly to people who are in coaching and they're like, that was useless, that can't help me, right? What could they possibly teach me? I always think, oh, this is really about you deciding what you want to get out of it. And you can do it. I mean, anything, you can go through anything just for the motions, right? We all do that for things, right? There's times, unfortunately, we show up at meetings, are not engaged, right? Our level of engagement is limited, or you can go there for the purpose of, for the purpose and be a participator and a change agent. So I think that's true of education, right? You can do it for the paper. So I think it's a mindset for people. You can go into a coaching with a professional coach with the intent of really learning about yourself and improving and changing, or you can go into it just and assume that you have nothing to learn. I tend to be of the mindset that there's a lot I have to learn every day, and I'm still trying to figure it all out. And when I figure it all out, I'll probably just lay down and take a nap, a very long one. But so I do think that's part of it. But I also
Yes.
think, there are people who worry about the cost for healthcare. My sense on that is that I think the long-term return on investment is greater if we have nurses. I tend to be very pro-nurse. I think when I look at nursing and I think we're the only person in the healthcare system who really understands, for the most part, what everybody else does, right? So if you think about your role in a hospital, when pharmacy goes home at night, you mix the meds. When dietary leaves, you find somebody a turkey sandwich. When the physical therapists go home, you're getting the patients out of the bed. When medicine is not there, you start the code. So I think nursing has an understanding of all of the pieces of healthcare. I'm not claiming to say we are, we have the depth of knowledge, but nurses have an understanding of knowledge of the healthcare system that is different than everyone. And I think the return on investment of getting nurses the skills and knowledge to be able to lead healthcare change, even in the office, at the bedside, is really, really critical. We are not doing the things that we need to be doing in healthcare particularly in the US. When you look at our healthcare outcomes and our spending, our healthcare outcomes are not in line with the amount of money that we spend. And we need bright nurses, again, with the knowledge, skills, and abilities to make change, to be able to do that. So the cost, I think, in the end, the return on investment will weigh out. People will say, well, we don't have data on that. Well, unfortunately, you have to do something in order to have data on it, right? And we have to be able to track it. Unfortunately, right now in our country, we don't necessarily have the ability to track nursing education outcomes very well. And it takes a long time to get that research. So we don't have it. I think we know from history, Linda Aiken's work and many other individuals, that education does improve outcomes over time. I think we are seeing that in certification exam pass rates as an example. When you look at graduates of nurse practitioner master's programs versus nurse practitioner doctoral degree programs, nurse practitioners from doctoral degree programs pass their certification exam at about a 10% higher pass rate. It's pretty substantive. I think we hear people complain, talk about cost of education, cost to healthcare, time. The other thing that people will say is nurse practitioner outcomes are great now. And I say, well, nurse practitioner outcomes are comparable to our physician colleagues. That doesn't necessarily mean they're great. Does that make sense?
Yes.
Because our healthcare in our country is not great.
Yes.
So, staying at the baseline is not necessarily a place I would be like, yay, I want to stay there. But because we're not really doing a great job in our country of healthcare access, quality measures. When you look at things, as both you and I are interested in diabetes, you think, oh, wow, we have a lot of room to grow.
Oh, yeah.
We have a lot of improvement to make. And again, not all of that's provider related. Some of that's the public, but I think nurses have an opportunity to help shift the culture of health in our country.
I agree. And I think we're really good at seeing people where they are and
Yes.
understanding the barriers our patients face, maybe more than anyone else, and that the interplay of that is critical to patient outcomes. And nursing is primed to step in and change some of those and to meet people where they are in that and to produce the data that says XYZ.
Yes.
I didn't put this in my list of things to talk about, and this is my hesitation too in nursing, is that sometimes when we mandate these higher degrees, and we've seen this, we've been having this diploma versus, and I'm a diploma grad, associate degree versus bachelor's degree discussion for a long time and excluding LPNs. I think sometimes when we make these degree levels, sometimes the only way to come into practice for very bright and critical people who have barriers in their life is to climb this ladder this way. And so I'll be honest, I've struggled a little bit as a person who knows that, who's been in the nurse practitioner education world and clearly seen the difference in my master's students in preparation versus the DNP students is the discussion on, mandating that, although I do think we need to have a discussion on clinical hours, but that's where we get into things like guidelines, right, for education and where they are. I don't want to leave anyone out of the discussion of who can get a DNP degree and how you enter this nursing ladder, because we need all the bodies.
Yeah. So, it's interesting because I've had this conversation with a lot of people, and one of the things I do is I go and look at the data. And I think when you look at the diversity data, it doesn't necessarily support not having, not BSN to DNP has an impact on diversity. So we see a very, very similar representation of those who go through BS to DNP programs and those who go through master's programs. It's not far off. So that, which is great. I think there always is the financial challenge. One of the things I often will say is that question doesn't necessarily come up in the physician world, in the pharmacy world, the physical therapy world. And we've figured out ways to make that happen, or we're figuring out ways to make that happen in medicine. I do 100% think it takes all kinds of individuals from diverse backgrounds to care for our nation's and our world's people. So we have to figure out how to do that. I think in the end, for me, though, it always comes back to patient care and quality outcomes, right? So what do we need to do to efficiently and effectively care for the people? And I do think there is at some point a too far land, right? Where you can spend, right? Everybody could drive a rocket ship to work, but that's probably not cost effective.
Yes.
Is getting there, right?
I agree.
Right. So I do think there is a balance of how much we do spend on education. I'll be honest, and that this is probably a whole nother podcast. I think there's lots to be done there, and where the cost of things go and how the money is spent, both in education and in healthcare.
Agreed.
That's probably a whole year-long series of what the cost of education is, and really how do we focus on that. But I understand that concern. I do think we in nursing, I think, tend to say that probably more than anybody, and I can't quite sort out why. But I don't know that that's necessarily a conversation with our other partners.
Yeah, no, and I think it's worth bringing up because it's a conversation point that keeps coming up. Yeah. I wonder if it's because we are so inclusive that we do see everyone where they are, that we just keep worrying about everyone, which is good. But someone said to me, and Because I did this PhD before there was a DNP degree, although I don't regret a minute. I loved school. Sometimes I'm
Right.
sad that I'm not still in school decades later. But if I had spent the 3 to 4 years in a master's degree and then another 4 years in a doctorate degree, when it was all said and done, there's 8 more years of college besides my undergrad. If someone had said, in 3 years, we could get you all of this education condensed, it's everything you need, I would have kissed them.
Right.
Yeah. I mean,
Right.
it's not going to be an easy 3 years, but it's 3 years.
And
And
it's
sometimes
done.
I don't think we say that enough. Someone wise said to me before I started my doctorate degree, in 4 years, you'll be the same age you're going to be in 4 years, regardless. I mean, do you
You might
want to
as well
do
go to
this or not?
school. Yeah, you
Right.
might as well just go to school.
Exactly.
It is,
Yep.
it is, I think we're seeing some of our younger generation be excited about that and have that, right? They are coming back to school and thinking, I'm gonna do it now. I'm gonna do it now while I'm young. I'm gonna get it done. I'm gonna have the credential, and then I'm gonna launch my career, and I'll have what I need to be successful. And I love that. I love that drive in them. It's
I do too.
exciting.
And they have the most creative ideas and topics, and they just are not mired in the system. They really do think outside the box. Definitely.
They definitely do. Yeah. I'm always humbled all the time by our students. Sometimes I'll have them in my practice with me and I think, oh my gosh, they're so much smarter than me. What am like I hope I can
Yeah.
answer their questions because they really are. They're knowledge sponges. They're sucking up everything we tell them. And they have the World Wide Web and ChatGPT at their fingertips. So they are looking up everything and know everything. And it's impressive. Yeah.
It definitely is. For those people who are already in practice and they say, okay, I'm going to check this out. I'm going to check out a DNP degree. What can we do to help them? Where should we direct them first for people just beginning the discussion or the thought process on I'm going to look at going back to school to get a DNP?
My first recommendation would be to go to some of the professional organization sites. And, so AACN, the American Association of Colleges of Nursing, is really the, leading graduate degree nursing professional program, professional organization. And they have a whole webpage on DNP programs. So I think you can go to the webpage, look up schools in your area, look up schools in your state, but also there's information on there about what is a DNP, right? Go back to the doctoral essentials and look them up and look at the position statement on why, right? Understand why it was important. If you have access to journals, you could look that up, go to the library and just kind of sort out why did this whole thing start? And I think if you go back and you look at that, it helps you kind of gather that understanding and that knowledge and to think about then what you want to do when you move forward. I do think it's important for prospective applicants to consider where they're going to go and what type of program they're interested in. And again, what are you trying to get out of this, right? Is it simply the credential or is it really knowledge and learning? And then think about how you would best get that. And everybody learns differently. Everybody has different interests. If you're interested in really having a better understanding of rural healthcare, there are probably better places that do rural healthcare and have faculty who have better expertise in that than maybe urban or policy related. If you're thinking about policy, where would you go to learn that? So, and again, not that the program necessarily has to be 100% focused on that, but thinking about the faculty in the school and their resources is important. So I think once you kind of get a general idea about what it is you're going to school for, I think you should have an understanding of that before you apply. I often say to prospective applicants, think about how much time it took you to buy your last car. Please spend at least that much time before you decide where you go to school. At least that much time, right?
I
So
completely agree.
yeah,
And it matters who are the faculty, what are their research interests? Does the school support a clinical practice? Are you going to get, what does that look like if you're shaping your future and investing
yes,
some money into it? Yeah, I
yes.
agree.
So I would say that, then as you mentioned, I'm the president of the National Organization of Nurse Practitioner Faculty, and we have tons of resources for educators, faculty, in particular, about the DNP, but there's lots on there on our website about the DNP, what it is, why you should consider a DNP if you are a registered nurse coming back to a nurse practitioner program, and kind of some of the position statements. Lists of schools are on our website who are involved in our organization. So I think there are lots of places to go. Of course, you can Google it, but as we all know, lots of schools pay to have their school at the top. So I'm not necessarily sure I would 100% go with that. But looking at the professional organizations and trying to find them. There are other more, community type organizations. There's a great organization called DNPs of Color, Doctors of Nursing Practice, Inc. There's quite a few organizations out there that are focused on the DNP as well. And so going to some of those or professional organizations might be a great place to find schools and knowledge.
We wholeheartedly second that. We love being partners with non-functional educational projects, but both the Doctors and Nurse Practitioners DNP's organization and DNPs of Color are doing amazing work.
Yes,
together.
Yes, absolutely.
Yeah. Good,
great stuff out there. Yeah, so those are wonderful places to go and find, people who've gone through programs.
Yes.
So, in your local organization, again, as you mentioned, I was involved with the Nurse Practitioner Association of Maryland, and there's often meetings. So every state has a professional organization, the AANP, all of these organizations have people in places where people can meet up and talk to your colleagues. What did they think of the program they went through? Did they enjoy it? Did they like it? What would they change? Would they go back to that school? What did they not like about it? Is that still the same there, right? Things change. So, talking to people, I think word of mouth is a great strategy too, but talking to people who've been involved in it and people who are knowledgeable about it.
Yeah, I agree. I think that's good. And for the nursing faculty who are out there in NP programs and DNP programs and talking to students, certainly they can be good mouthpieces and stewards of the education and make it inspiring, giving people some options and pushing people. I think sometimes, I know when I was a faculty member, I would get in this rut, the discussion board rut. And
right.
Grading
just plodding along in the day-to-day. Well, that's my thing. What is it that we can do to excite people about it and show them how they can do super cool things? I just had an alumni reach out to me and said, I just wanted to share with you this amazing news. And she got this huge appointment. I could probably share it here. She was just appointed as the first nurse and first woman to be appointed as the director of the National Disaster Medical System, Helga Scarfbell. And she's one of our alumni. And I think sharing those stories with students and that's the power of education, right? And so those really super exciting things make me, again, want to push nurses and say, look, this is how we get to make the decisions, right? You've always wanted to make the decisions. This is how we get to make the decisions. You have the credentials and you have the knowledge to run and change healthcare, and nurses are well positioned to do that. I think, as I mentioned earlier. So those are the things that get me excited, that help me kind of drive this momentum forward, which sometimes can seem like, a pedal bike as opposed to a fast train trying to get there. But we just keep pedaling, and hopefully there's a couple of really exciting flowers along the way, the exciting stuff, and keep moving people forward. And watching the difference in how students, how they learn, and
and getting excited from their excitement, and that it's a good place to be continuing this education journey for nurses.
It is really exciting.
I appreciate that you're in it and that you're willing to talk to us about it. I think it's a
lot of fun. It is a lot of fun. I think as we continue to see more people across the continuum of healthcare, get these additional credentials. I'm in Maryland, and we have been very fortunate that many of our nurse executives have returned to school. And I think they see the benefit for them and how they view stuff differently and how they use those skills to really sit at the table and change healthcare, and the opportunities, that the doors it's opened for them and the paths that it's created for them, the relationships that they've built through school and the partnerships that they've built with other colleagues. I think then they're encouraging their leaders to go back. And I think that's probably one of the best strategies that I've seen is having people at the top have those credentials, so that other people can see it as a strategy to get there, if that's their goal. Not all of them are, right? Not everybody has that goal to get to a leadership position or administrative position, but I think it helps them see how they can make change.
Yeah,
Which I think
agreed. And the peer influences is really
Yes.
important. Yeah.
Yes, watching your colleagues go back and seeing that they survived it, right? They're excited about it. They're happy about it. We have to get rid of that urban legend about the DNP project, that it's torture, but because I don't think it has to be, right? I think that's one of those.
Exciting.
It is exciting. It's super fun, right? I think some of that goes back to probably early days when it was somewhat modeled after dissertation. It has a little bit of that lens, but I think it's really exciting. One of my favorite graduates, one of our alumni, is now oversees quality improvement and change at a large healthcare system, a large local healthcare system, is amazing. And she would mentor our DNP students in their projects, and particularly in the early courses where they were trying to figure out what they were going to do. And she would say, you know what, like, ticks you off every day? Like, trust me, I know there's something that gets on your nerves every day at work. What is it? That should be your DNP project. Is it that you can't get people, nobody does this happens, the labs come back hemolyzed, whatever it is, right? Whatever that thing is that gets on your nerves every day.
I love that.
How do she would probably use different language. She didn't always use the word ticked, but she would say, what is it? And focus on changing that. It's super exciting. You can fix something, right? You can fix these things that drive you crazy about healthcare every day. And there are plenty of them, as we all know, right? Whether it's the hand-sewn masks that we all endured, or whether it's whatever it is. How do we fix those things and improve patient care?
I love that. I think that's a beautiful note, really, to wrap this up on, because we have become a society that just likes to sit behind a keyboard, an anonymous keyboard cowboy, and complain. And we cannot do that. We have got to be problem solvers, and a DNP degree is a beautiful path to doing that, to really being the problem solver. So many of our listeners are practicing NP. So listeners, if you have questions, email us here. We will pass some of those along, but maybe we'll try to gather the answers about DNP programs and bring them back. And Dr. Idzik, I appreciate you being here and talking about this. We've got to talk about so many things in NP education. I will reach out to you again.
There's a list of them. So thank you so much. Thanks for inviting me. I will tell you, I've early on fell in love with the DNP, and I think it's a truly a beautiful way for nurses to take all of that knowledge that they have and just grow it.
I agree. It is. Well, thank you so much for being here. NPACE listeners, be sure to check out npace.org for information on all things NPACE. We've listed our 2025 in-person conferences and our virtual, but we also have on demand. We have for any of you interested in NP education and teaching, because it's completely different than other types of nursing teaching, we have a new faculty development program with NOMP. You can find it at learn.npace.org. An ANCC accredited provider for continuing education. And so reach out to us if you need that. You can find the podcast on Spotify, on YouTube, on Apple Podcasts, and we'd love to hear from you and your questions on DNP. Thank you again, Dr. Idzik, for being with us. And we'll see you all the next time we get together to talk.
Thank you.